Nearly 35 years ago, Mayo Clinics opened their doors in Florida. The first was right here in Jacksonville on October 13th, 1986. So joining me now is Dr. Gerardo Colon-Otero, who's been with the hospital from the start. So good morning, and thank you so much for joining us.
Thank you for the opportunity.
Absolutely. Well, 35 years is a long time. Can you share one of your favorite memories coming to Jacksonville?
Oh, yes. I one of my favorite memories is just being so impressed by how the community embraced Mayo coming into Jacksonville. The news were on the front page of the newspaper, and the excitement about it was really quite noticeable.
And how has Mayo Clinic engaged with the community over the years?
So we obviously our success in Jacksonville has been highly dependent on the support that we have received from our community, and Mayo has truly, my colleagues here at Mayo had truly delivered on that commitment that we made to the city of Jacksonville in terms of bringing top-notch research programs, top-notch tertiary care programs, including solid organ transplant program, bone marrow stem cell transplant program, CAR T-cell, no cancer treatment programs to the community, so that the patients who have these diseases in the community of Jacksonville don't have to travel outside of Jacksonville to receive that top-notch care.
And as one of the leading institutions in cancer treatment, how have things changed over the years, especially treatment as technology has advanced?
Oh, it's quite amazing. For example, I do remember 35 years ago, one of the patients who I saw being a 30-year-old young man who was a non-smoker, but who had metastatic lung cancer. And back then, 35 years ago, the treatment of that patient was to refer them to hospice because we didn't have any treatment that would prolong his life. But nowadays, a similar patient is not surprising for a similar patient to live 5 years or longer with their disease. And we have not just first line, but second line, third line, fourth line, and fifth line therapy, and newer treatments that were not available 35 years ago. And what is going to happen over the next 5 and 10 years is going to be quite remarkable because the pace at which we're developing new treatments for that disease is quite amazing. And I would not be surprised if that same patient potentially could be cured from their disease 10 years from now.
That is amazing. And I know you've done a ton of research in health disparities. What are some things that still need to change?
Yes, so I think unfortunately there are huge disparities in cancer care or care in general, healthcare in our country, and those need to be addressed. I personally feel that healthcare is a human right, and we need to, all healthcare institutions need to work together to make that happen so that we achieve health equity in our country. Mayo is committed to that and is leading some of those efforts in the institution, working with our other health systems and working with organizations that provide care for underserved patients in Jacksonville.
And I just want to touch on that. We're still in Hispanic Heritage Month. Why is it so important to have diversity in research?
Is critical because as we develop all this new treatment, as I was mentioning about that young patient with lung cancer, it's going to be critical that those new treatments are evaluated and tested in the population that is representative of the population of our country and the world. If we fail to do that, we may fail to recognize which are the best treatments for all Americans. And it is critical that that is happening so that also as these treatments be developed, that all aspects of the population will benefit from these treatments as they're developed as well.
Thank you so much, Dr. Colon-Otero. It was a pleasure having you this morning.
Thank you so much for the opportunity to talk to you this morning.